Hello, I'm Virginia Carroll, and this is my clinical pathology portfolio video for VETT 222, summer 2017. Okay, so we're going to draw some blood today for pre-surgical blood work. I have a purple top tube with EDTA anticoagulant in it, and a white top tube with no additive for serum. It's the same thing as a red top tube, except for our manufacturer provider uses white top tubes. I've selected a 6cc syringe because I need 5 mLs to fill my tubes appropriately. Alright. And Lindsay's going to position Gabby. That's alright, Gabby. Okay. Alright. And I'm going to apply pressure at the thoracic inlet to distend the jugular vein and wet it with alcohol. And I'm going to palpate for the jugular vein. I'm going to remove the cap from my needle and insert, bevel up, and pull back on my syringe. Okay, I'm done. So you can come down and hold off right there. Lindsay's going to hold off to for VETT and hematoma. I'm going to put this in my purple top first so that it doesn't clot. Alright, this is a 2 ml. And I'm going to invert it about 6 or 8 times. And cap this. Replace the cap on the tube. I'm going to pierce it with an 18 gauge needle to release the vacuum seal. And then I'm going to allow this to sit for 15 minutes and clot before spinning it. Okay, so we have allowed our sample from Gabby to clot for 15 minutes. So I'm going to rim the clot with an applicator stick. And it was clotted adequately. And then I'm going to take another tube that's empty and fill it with water to balance my centrifuge. I'm going to place it in here. And our centrifuge is broken. So the timer doesn't work and we have to just kind of plug it up, and I've set a timer for 5 minutes. Okay, there it is. Okay, so now my timer's gone off for my 5 minutes. So I'm going to stop the centrifuge and unplug it. Alright, so we have our sample. I'm going to open my empty, clean, new tube. And I'm going to gently transfer the serum into the new tube. already is labeled with my patient's name on it. Okay, this is a sample that I drew from Gabby, and you can see it kind of looks like strawberry sherbet. It is cloudy and pink, so it probably has a degree of hemolysis and lipemia. Hemolysis is usually caused by rough sample handling, either through the blood draw itself or pushing it through the needle into the tube, a moist syringe. If you used a whole blood sample that was frozen beforehand, those can all cause hemolysis. You can have false lows with hemolysis because the destruction of white blood cells causes a release of water, and you have false diluted concentrations of constituents that are found in the blood. You can also have false highs because the destruction of the red blood cells can release constituents into the serum and plasma that would not normally be found there. Lipemia is usually caused by not being fasted at least 12 hours prior to the blood draw, and it is caused by the presence of triglycerides in the blood, and it can affect the sample because directly after a meal you can have a higher blood glucose and phosphorus might be low. It can also affect your kidney assays because the glomerular filtration rate is transient after meals.